We're live. It's saying we're live, brother.
Yep. Yes, we are. Yes, we are. What's happening, bro?
Nothing
Yep.
much, my
Yes,
brother.
we are. Yes. All right. Facebook again has changed its platform a little bit, but hey, as long as it's working, I ain't gonna complain. What's up, Charlie? How you doing, bro?
I'm doing fine, my brother. How are you?
Um, I be honest, I'm looking forward to tonight. I'm looking forward to our discussion with General Hara. He's actually in the waiting room already. We'll bring him in a little bit early, but we'll see what happens. I know he has a presentation that he's going to do for our viewers. So I don't want to go on too early because I know a lot of our people come on
Yeah.
at 7. So I want, please, guys, share. This is going to be a blockbuster tonight. And General Haro has been gracious enough to come on our show. You all know about the announcement that was made yesterday. May 11th is the day that vaccine passport will go into effect.
Uh-huh.
And we'll let General Hara explain how that will work. I will. I just did want to say, I'm going to say this because I had permission from the family
Hmm.
that one of our viewers, one of our friends, very close friends, contacted me yesterday that her daughter, local Kauai family, very safe, never traveled, never traveled. Mask, wash hands, disinfect, masks in the car, disinfectant in the pockets in the door. I mean, just like us, Charlie, just like you and me. Um, Daughter wasn't feeling well, fully vaccinated from back in January, one of the first go arounds on the vaccinations, fully vaccinated, practicing safety, uh, not feeling well, goes to the doctor, gets tested, positive,
Mm.
fully vaccinated, not asymptomatic, kind of lost the taste of the smell, lost the taste, feeling a little under the weather. Not sure what the symptoms are today, but yesterday. So my point is again, people, the fact that you got vaccinated doesn't prevent you from getting the virus. All right, it does not prevent you from getting the virus. I just got a call from a friend probably an hour ago talking about. I'm not even going to disclose location, but Kauai person had tested positive prior, had COVID, never took the vaccine, does not want to take the vaccine, tested again, positive, sick again, second time on Kauai. My point in saying this is, and I want to thank our friend for allowing me to share. We're not mentioning names. Is that people? The vaccine is not the 100% solution, guys. It's going to prevent you from getting very sick, hospitalized, and dying, but it's not going to prevent you from catching the virus, and it's not going to prevent you from spreading the virus. So just be careful, okay? Just be careful. Last night, Patsy, myself, and her mom went driving around. Just take a ride, get out of the house, and driving through Kapa'a about 6:30 or so. People walking on the side of the road. Now I cannot tell if they're tourists or not. They sure look like visitors. Not one wearing a mask. Not one wearing a mask. So again, we control what we do. We control what we do, and we must do it. We must do it. So again, I just wanted to share that. Our guest is General Hara tonight. He's going to talk about the vaccine passport program in detail. He has a presentation that we're going to let him share, and then we'll open it up for questions afterwards. So I just thanks Charlie for allowing me to share that because I think it's important.
Mhm.
Uh, Remember 2 weeks ago, Charlie, you and I right here on our show said when they opened back up to safe travel, we both said that we didn't think it was going to be much different than October of last year when we opened up. And lo and behold, 14 days plus 1 day, 4 cases yesterday, 2 cases today, and more to come. more to come. And so we got to be safe. We got to protect yourself, Jacqueline. Exactly.
Yep. So you hit the nail on the head, my brother. You hit the nail right on the head. Nothing more to say, nothing more we can do. We just gotta practice safety.
Yeah. All right. So let's bring on General Hara. We'll talk story. We won't get into the presentation until 7 o'clock because I do want to. This is important, guys. You guys been asking for this for a long time. General Hara was willing to come on and share, and I know I don't have to tell our viewers to be professional in your comments. I will tell you. Um, you guys know the rules. I'm not even gonna say it. You guys know the rules, okay? All right, let's bring the general, a major general. That's one thing about the military, man. They're always early. You know.
Hey.
Awesome work. Awesome work ethic.
Yep.
Especially
How's
as a
it?
major general. Oh, look him. He's wearing his
There he
uniform.
is. There he is.
Good to see you guys. How you doing?
Good. For you. For you.
Good, good.
I remember, I think I may have told you this the last time he was on, General, is when I was in basic training, running around, and man, we'd see any officer, where's a second lieutenant, the little gold bar, we would shake. I don't think I ever saw a general in basic training. I may have seen him at the graduation far away, but golly, I still get that flashbacks right now. I'm shaking.
It's different now. Now it's like, what, bro? What do you like?
I don't think so. I don't think so. I do not think so. Yeah, General, thank you so much for joining us tonight.
Yeah, awesome.
I know you've been a busy guy. You are a busy guy, and Charlie and I appreciate you taking the time to share with our viewers. Our viewers have been asking for this for a long time. We didn't even ask you because we know it's just been crazy. So once we heard that the announcement was going to be made, then we figured the timing was right. And appreciate you agreeing to come on, sir.
Yeah, good. It's been almost a year, right, since the last time I was on. So good to do an update. Hey, how's the sound? Any echo or anything like that? Good to go?
Oh, perfect.
No, loud and clear.
Okay.
Loud and clear.
Well, I would like to say that been following you and your some of the uphill climbing that you had to do, because this is not an easy thing, and I just want to say we appreciate your thinking about safety. Always safety. We've seen it, we've heard it. We know why certain things have been put on the back burner, because certain safety factors had come through, and I think we're going to talk more about it because there's some other questions that we may have, and hopefully you have the answer, or it's coming out soon. Put it that way. But
Okay.
we just want to appreciate you being that.
Yeah, I just hope too we can move forward, right? Because it was a challenge. I had some issue with DOH, but there's new leadership, so I don't want to bash on them too much, and I definitely don't want to put politics in there because that's been eating my freaking lunch. I can tell you guys. But
Yeah,
I want to stay away from that if you guys don't mind.
Absolutely not. No,
Absolutely.
man. This is your show tonight, sir. I know that you have a presentation. I am going to ask that we wait till 7 o'clock because.
Yeah.
Okay. Somebody just one of our viewers said, and the general is early. Wheel of Fortune is not even pow. You see, these guys, their lives surround the show, so they wait till Wheel of Fortune and they know. So if you don't mind, we're going to ask everybody to share right now because we're going to get started in a couple of minutes. And again, people, a lot of you have asked for this information. A lot of you have asked Charlie and myself these questions that we are not in any position to answer. So, Charlie, did you scare him away? Oh, there he is.
No, I just have to grab a drink. I don't like drinking in front of everybody. Yeah.
What I did want to say is later on, I will be asking you, and there's something to think about, is the concepts. There's certain concepts that we definitely have to think about, especially when the implementation of the programs that you're in charge as each. I guess what's going to be a real challenge is each airport getting all the same understanding, the same application, where the information. So that we can do that later on. But I think I think if we hear from you and you kind of like paint the picture for us and get a better understanding, then I think we should be okay. Because I, like myself, um, I even asked Mel several times. I said, I know we got to get on database. How do you do it? How do you do it? And I heard last night, and like I said, we'll wait, but just making small talk. I'm glad, if they're gonna do it in Hawaii, you can pick off that database. It's real easy because the people took it. But then when you're rolling the dice for the bigger one, I think that's the one that a lot of people are concerned. But I think you folks have it hopefully under control. Now, as far as the DOH, I understand head of contact tracing, that Dr. is that Roberson, Emily, is that her name? She was head of contact tracing.
Yeah, Roberson. I think she resigned recently.
Yeah.
Yeah, I
So-
don't have any details on that. In fact, I found out while I was in Arkansas.
Oh, okay.
Yeah, so I don't know what the details are on that.
Okay, hopefully they got somebody equally qualified. They can just step in and do it. I think it's gonna be a big. Okay, thank you, Mel.
All right. Well, ladies and gentlemen, thank you again for joining us tonight. I see the numbers climbing. Again, long-awaited Hana Ho from General Kenneth Hara, who is in charge of Haima. He's the Adjutant General for the state of Hawaii, the top dog for the Guard. And we're blessed to have him and honored. And we're going to turn it over to him. And we're going to talk about and I'm not sure what the official term is. I think we call it the vaccine protocol passport. I think the state is calling it an exemption, whatever it is, basically allowing people to travel inter-island starting May 11th without testing or quarantine with a valid quarantine or a vaccine card. So that's the topic for tonight, guys. And just so that you know, I mean, I can see the questions starting to scroll. We're going to let the general do his presentation. Hopefully that answers your questions. When he's done with the presentation, because I want to pay attention to the presentation, I'll be selfish right now. I don't want to be scrolling and looking at questions and writing them down. When he's done with the presentation, we'll ask you folks to pose your questions if he hasn't answered it already. If you came on late and he already answered your question, I'll go back and watch the replay. Okay? I don't like to sound like a jackass, but the general's time is important, and we want to respect that. So, General, take it away.
Hey, Mel, Charlie, thanks again for the opportunity. I got to tell you, the first time I did this show, I was a little bit apprehensive, but after I was done, I had so much fun. It was a great time. It was a really great time, and I really appreciate it. It's more than Kauai, right? It's far-reaching throughout the state. I was seeing some of the comments after the fact, so I appreciate the opportunity. I do want to share a presentation, as you had mentioned, so give me a little bit of time. Let me see if I can share my screen. Hopefully this probably can come on. Okay, hang on. There we go. Okay, can somebody, one of you two, confirm that you can see the presentation?
It's on.
Okay, good. So I know you said you wanted to talk about the changes to the safe travel program and the vaccination exception, but because it's been about a year since we started this response, I wanted to give a quick overview of how I looked at framing the response and then kind of reviewing, where are we at, and then go into some of the newer things that you had talked about. The one takeaway for everyone on here, if you look at the bottom left at hawaiicovid19.com, almost everything you need to know about COVID, about safe travels, Department of Health statistics, if you go to that site, that is the website of record. And you'd be able to either find the information at that site or find the link for the information that you're looking through. So just remember that, hawaiicovid19.com, no spaces, no dashes. Okay, so real quick, like I talked about, we'll go over the guiding principles. I'll show you how I had kind of visualized in the state response framework. We'll talk about the Safe Travels Hawaii, the vaccination update, COVID-19 timeline, and then what's next. And you guys, that's kind of the stuff you're asking for. So the first thing, when I came in as the incident commander, I said, our number one priority for everyone is to save lives and prevent human suffering. That trumps everything else. Everything we did was that in mind. I don't know if you guys remember the first press conference was out there. I told the media that for the state to be successful, we need to move at the pace of unprecedented crisis. We cannot use the same bureaucracy, the same principles. Because again, focused on saving lives, preventing human suffering. The other thing I told my team is we need to be responsive. That is the most important thing. For us to be responsive, we need to anticipate needs. And then once we identify those needs, we need to organize and resource ourselves. So then when that need pops up, we're ready to execute. So case in point is that, if you recall, remember had all that hype about, hey, do we have enough contact traces, disease investigation, all that stuff, and a lot of media uproar that, hey, we don't have enough capacity. When we were finally asked, hey, Hawaii National Guard, can you support with this? We said, yes, we can. Okay, how long is it going to take? I said, well, they'll be there tomorrow. And they're like, what? I said, we had anticipated this need. We had organized, we had trained our people. They all received the contact tracing training. And the very next day, we started sending people to support. And that's why I think we've been successful with that mentality of looking forward and always trying to predict what the next requirement is going to be. The other one is most important and why we truly are so successful is, the concept of Malama. And in following all those safe practices and the non-pharmaceuticals that we've been talking about, wearing your mask, washing your hand, keeping your distance, avoid large crowds, those things are really what stopped the spread of COVID. And it's really all of the sacrifices that the community has done is why we've been successful. And, Kauai is really case in point, right, with the lowest numbers throughout the state as far as a county. And then the philosophy of mitigating risk through layered safety measures. And I'll show you that in another slide, especially as we talk through the Safe Travels Hawaii program. So in the military, I like colors and I like being able to visualize how do we get from the problem set, different lines of effort to getting after the ends. If we don't know where we at and if we don't know where we need to be, it's hard for us to get there. So the response framework, I couch it as lines of effort. It's a military term. So we said, what policies do we need to enact? And then using the pandemic control action, so prevention, detection, containment, and treatment. So just to give you an idea, remember when we were, having major spike in cases, we did the stay-at-home order. We did issue the mandatory mask statewide. So those are the policies that drove how we tried to control the pandemic spread in the state. For prevention, we got CARES funding. I spent over $100 million on personal protective equipment and industrial hygiene products. The industrial hygiene is like the alcohol, cleaner, disinfectants, mist sprays, and the equipment that supports that. If you look at detection, the best way to detect it obviously is testing. So besides community testing and those that think they're sick, we also created mobile testing teams that would go into a site where we think was an emerging cluster, test the people, identify the index cases, do the investigation on who the close contacts are, and then test them as well. And that way we're able to get into the next step of containing the disease. So between the detection and the containment, and then we also did, quarantine and isolation locations, again, trying to contain that and prevent the spread. And finally, what we try to do is figure out, hey, if there's a huge spike that exceeds the capacity of our hospitals, how are we going to address that problem? So rather than wait until they're full up and then people start dying and lining up like we're seeing in India, we said, hey, maybe we need alternate care facilities, building additional hospital space, turning, big stadiums into hospitals. I think you guys saw early on in the pandemic on the East Coast, they were doing things. They spent hundreds and hundreds of millions of dollars creating this hospital capacity. So as we were considering this, and I looked at, man, this thing is so cost prohibitive. It's ridiculous how much money we'd have to spend on this. I contacted a 3-star general who is part of the planning on the East Coast, and he told me, hey, you know what? Don't waste your money on that. We built all this capacity, and to be honest, we only used about 3 to 5% of the space. What you're gonna need if you have a surge is the staffing. The emergency care folks, the respiratory guys, all that specialty skills. That's really what you need. So we started working with the Department of Health and then with FEMA, and we had put in a request for federal assistance just to bridge the gap so that Department of Health could put in a contract for this hospital staffing. And we were able to get those people in just as the surge was kicking off, right? Responsiveness, anticipate needs, organize, and resource yourself to meet those needs. And definitely we're successful in collaboration with our federal partners and most importantly, with the State Department of Health. So shifting over to the Safe Travels Hawaii, we launched this in October 15 of last year. I think it's been really successful. Just the basic things, right? 72-hour pre-test. It has to be a nucleic acid amplification test, NAT test, primarily that PCR that you guys keep hearing about. And then we did the travel screening. So you go in there, you fill out the Safe Travels application, and then there's a health survey on there. You come into the airport, you get screened. Some of the counties also asked that the travelers load up the Aloha Safe app. Obviously, that's a voluntary program. And those that did not want to participate, well, then you just go into the self-quarantine. And then as we're doing this and watching how successful this Safe Travels Hawaii, also a phased reopening, primarily of the tourist and hospitality, economy sector, and then working with law enforcement for both the compliance checks and if needed to arrest people and hopefully convict them. So how are we doing? We did the press conference yesterday, and Lieutenant Governor Josh Green, he held up the slides, kind of this information. His current data was yesterday. I pulled up today's data. But if you look at January 5th, 2021, just as that second spike was happening, we had 140 daily new cases. These are all on a 7-day average. The positivity rate was 3.48%, and 105 people were in the hospital. Fast forward to today, and then at the bottom, you can see, like that heartbeat, that's showing the number of cases. And you can see how we spiked up, came back down, kind of leveled off, spiked up, came down, spiked again at early April, and then now we trending in the right direction, right? And at lower cases. So 80 new cases per day, 1.6% positivity rate, and 43 people hospitalized. Less than half of where we were on January 5th. For the vaccination, we are currently in phase 2. I think you all know that April 19th, the state opened it up to persons 16 years and older to be able to get the test. So right now they're doing the vaccination with the Pfizer, Moderna, and then the Johnson & Johnson vaccine is temporarily on hold. But we're still, if you look at this top left area, we still are here right in between limited supply and additional supply. So even though we opened up, it's still going to be dependent upon how much vaccine doses we receive in the state. This is pulled off the DOH website today. And again, go to hawaiicovid19.com, you'll find a link and you can get to this page. So as of today's data, 1,087,000 doses administered. And that equates to about 35% of the state's population that received at least their first dose. And they're doing pretty good at, if you look at the other numbers, they're doing pretty good at, the supply gets in, it's not staying in storage, right? As soon as possible, the state, all the counties, and our federal partners, everybody else that are vaccinating are getting shots into arms, which is definitely what we want to do. So switching over, this is related to the press conference we did yesterday in the state of Hawaii vaccination exception. We're calling it an exception. It's not a travel passport. There's vendors that call it that. It's just an exception off of our order. And it's just inter-county. We're not doing trans-Pacific yet. And the reason why it's just Hawaii, Maui, and Kauai, because Oahu has no restrictions. So it does not pertain. You must be fully vaccinated. I'll show you a chart that explains that more in detail. You have to have been vaccinated in Hawaii. And the only reason is there is no way at this time for us to validate it that you're in fact vaccinated. There's no central database nationally. We're working with the Department of Health to tap into their vaccination database that's linked to that VAM system that everyone's talking about. So you register in Safe Travels, and then you get your QR code, and then you accept it. And I'll talk a little bit more in detail in the next chart. But the next one, I'll show you the 15 days, and then I'll get into the stages. So it's the definition: 2 weeks after receiving your last recommended vaccine dose. So what that means is if you had Pfizer or Moderna, that's 2-shot series, right? So after your second shot, which is day 0, then you count 14 days, and on 15th day is the day that you will be accepted from the travel quarantine, inter-island travel quarantine. It's simple, right? You get fully vaccinated, which is that 2 weeks following. You must have been vaccinated in Hawaii. You go to hawaiicovid19.com. There's a travel link. You register in the Safe Travels Hawaii digital platform. You fill out your information, and you can do it even if you're not traveling. You can go ahead and register in the Hawaii Safe Travels digital platform. When you are ready to travel, you complete all the questionnaires in there. There's all these forms that you fill out. And then now from May 7th and beyond, there's going to be a section for the vaccination exception. So they're building that right now. So you'll put in the information, right? Where did you get vaccinated? What type of vaccine did you receive? What's the lot number? What are the dates? Your date of birth, all that information goes in there, because that's what the system will do or use to, as they tap into the state of Hawaii database to validate the information. And then none of that information is going to be pulled. It just validates what information is there, and then you get the green check mark that you cleared. And then you'll be issued a QR code. So that's important. If you don't get the QR code, that means something is wrong. And then as part of that, you need to upload a copy of your CDC record. So that card that you get, you either take a picture or PDF file. And to be honest, that computer system or that digital platform does better at looking at the PDF file as opposed to a picture. Because sometimes blurry, or you guys take the picture crooked or whatever, some critical fields are missing. So we prefer the PDF. Also, if you did your registration for your vaccine through that VAM system, and you have your login information, if you lost your card, you can go back in there, print out the VAMS printout, and you can upload that instead of the CDC card. Then you travel. We talked about I talked about the layered safety measures. So you're going to wear your mask, watch your distance, wash your hands often. Those non-pharmaceutical measures will also help to mitigate risk. So you follow whatever the airport rules are, and you follow the current aircraft safety protocols. Then when you get to the arrival airport, the screeners will be there. They'll screen your thing. You may be asked to show your actual card if either there are issues or maybe, I don't know what the county's going to do. Maybe every so many travelers, they want to see the card, or some may say every traveler, I want to see your card or your VABS printout. So you got to have that with you when you travel. Treat that like a passport, although we're not calling it a passport. And then you'll receive your vaccination exception and good to go. Also, what's really great is we're building into the program is once you do this and you get accepted for a vaccine, you don't have to do that portion again. It'll be saved in there. So all you do for your next time you travel inter-county, inter-island, you just plug in your travel information and the health survey and the other data, and then you don't have to worry about the vaccination information. So people ask, hey, what if I lost my card? This will be posted on all our sites. We showed it on the news the other night. The bottom line is, if you got vaccinated, contact the locational provider that administered your vaccine. And then, if it was a pop-up pod, like the state ran the Leeward Community College pod, there's the phone number. If it was another island pod that was run by the Department of Health, you contact the district health office. And then, you had the sites that was at Pier 2 and the Neil Blaisdell, then you either call Queens or Pacific Health. And then if you don't know what it is, then you call that 586-8332 or the 833-711-0645. And then this chart shows the information that you'll be asked to provide. So,
General,
yeah.
can you go back to that slide real quick?
Sure, go ahead.
Hey, people, write the numbers down for your respective situation. Write them now. Okay, so I don't have to go back to the slide later. And I sound like a school teacher, but yeah, just there it is, guys. You fit in one of those blocks. Just take a minute, write down the numbers. If
and in a couple of days, like I said, I'm gonna get it posted in all of our public-facing websites. So remember, HawaiiCovid19.com. You cannot go wrong if you go there, and you'll be able to find, I would say 95% of the information you need.
Thank you. All right, you can go.
Okay, good. So what's next? So we just announced the inter-county / inter-island vaccination exception. The next step, so, I told everyone, as we move forward, we got to move cautiously, right? We don't want to open everything up, and if something gets jacked up and cause another spike, I don't know what it is. I don't know what to throttle back. And that's why we said, we're not going to allow CONUS travelers to be able to get this vaccination exception. One is because we cannot validate their accepted, and then those that travel that are from Hawaii, got vaccinated in Hawaii, we don't know is because they went to the mainland and get all these other variants that, they still bring in the virus back. So we're going this one step at a time. Inter-county, inter-island first. Then the next one would be Trans-Pacific, continental United States and Alaska, but still just for those that were vaccinated in Hawaii. And again, this includes military, those vaccinated through the VA, and those vaccinated to the federal pharmacy program. We'll take a look at that, see if we have any spike, if nothing happens. And then if we start seeing that, there's a lot of vendors working on trying to validate people's vaccination. As we work with these vendors and they can prove to us that, yeah, there's integrity in how they're proving the vaccination, then we'll open it up to Trans-Pacific, continental United States, and Alaska. Wait at least for 2 incubation periods, which is about a month, and then see if we can open up to international. And then, at some point we get to this herd immunity, right? They're saying 75 to 80%, 85% vaccinated or, have the antibodies because they're sick. And we start seeing the spread stop and the hospitalizations go to near zero, and then nobody's dying. Then we'll terminate this whole Safe Travels Hawaii program altogether. And if you go back to the Trans-Pacific, we're hoping by this summer to be able to open up for tourists and everybody else to start coming back to Hawaii. And then I don't know if everybody gets vaccinated and we get to that 75 to 85%. Me personally, I'm hoping somewhere about the end of September timeframe, we can really start opening up as we see the infections going to near zero, hospitalizations to near zero, and deaths to zero. So that's all I have. Again, just a reminder, wear your mask, watch your distance, avoid large crowds, and wash your hands often. Back to you guys.
Thank you, General. Appreciate that very articulate presentation, and I hope the people can appreciate that. You know, for a lot of us lay people, we don't get to see the all what's going on in the background. I think you clarified a lot of things. I just one question I have is as far as the verification. So when someone loads up their card into the system and fills out all the questions, is that going to be validated by somebody prior to the travel? So when they arrive, let's say someone's coming to Kauai, they put their vaccine card in the system and they get a QR code. Does someone from the state actually validate that Mel Raposo got that vaccine with the lot number and the location? Is someone actually going through that data and verifying that that card is valid, it was assigned to Mel Raposo, and then get the QR code? Is that how it's going to work?
First, I should have clarified this earlier. Is although this is a statewide policy, the screening is going to be the responsibility of the counties. Early on, you know, Charlie, I think it was you that mentioned, hey, is it going to be the same standard at every airport? And to be honest, I don't know. And to be honest, I don't think so, right? Because every county does things differently. But the standard would be the same, but how they operate will be different. So that's it, Mel. You know, I think the counties will learn initially because we don't think that the system, a Safe Travels platform, will be advanced enough to be able to tap into that database and do it electronically. When we first launched on May 11th, more than likely it's going to have to be a manual check off of information with DOH. And if the counties are smart and if they have the manpower, it makes more sense to do it ahead of time, you know, before the guys fly in, right? Because if not, you're going to be bogged down. If you have the arrival airport and the guy's got to go like, oh, validate, let me see your car. That's going to take several minutes and the guy's going to be backed up all the way. When we get this thing really functioning digitally, yes, that thing's going to be done instantaneously. So you upload your information, the system will run the check with the database, and then besides the QR code, you're already going to be cleared. So as you're coming through, you just show your little green check mark. Okay, bro, you good? Thank you. And you know, not going to even be a minute for you to be screened.
So right now, and just correct me if I'm wrong, because again, for all of us, it's the first time we're hearing this. A passenger arrives at Lihue Airport, they go through the screening line. The Kauai screener, the traveler will not have been validated at that point. The screener on Kauai is going to have to validate, basically look at that card and make sure it belongs to the traveler that's in front of them, right?
At this time, I cannot answer that because we're working with the counties now, right, to figure out what's going to be their process as they operationalize the screening. So, you know, again, my recommendation would be if you can pre-screen ahead of time, it's going to have to be a human that looks at it and verify it off the database and say, yeah, this person has, yes, in fact, been vaccinated, and then turn them green manually. They can do that ahead of time. But I don't know if the counties are going to do that.
But when the person signs up for this thing and uploads the copy of their card, does the counties have access to that prior to the person's arrival? I guess my concern is that it's the validation of these cards are going to be done at the arriving airport, and what will they have other than the card from the traveler? Is there going to be any way that that the county or yeah, I guess the county going to be able to
Yeah.
validate before arrival?
Yeah, so the counties have administrative rights. So they would be able to see the travel record prior to the actual date of travel.
Okay.
So they could set up, a function, because we actually did that on the state side, and with support of the Attorney General, some other departments, and Department of Health, the ETS guys, we have to surge and go there and start clearing people out, so it can be done. But it's manpower intensive. But that's probably the best way is to pre-screen and validate these folks even before they come through. And they just, like I said, right, show the check mark and leave.
So the check mark on your safe travels part, does that mean it has been validated by someone already?
Yeah, if you get just get the QR code, then that means the info is there, everything was accepted, and then you can be screened. But if you actually get that circle with the check mark, then that means you've been cleared.
Okay, and that means someone validated the information that was uploaded with the state's database to make sure, in
Right.
fact, that person was vaccinated.
Right. Just to give you an example too, I said I traveled to Arkansas, and then on the way back I flew on United Airlines. So from Arkansas went to Houston, and then when you got to the gate that was flying to Hawaii, they had this computer thing set up. Checked my QR code, something was wrong. I go to the table, I show my paperwork. They fixed everything, and then they cleared me right there at that table. And then I was issued a wristband. And then when I got to Honolulu, walked right through, not even stopped for 5 seconds. You just go left, you get the wristband, you out of the airport. And then if you don't have the wristband, boom, you go right and you go to the screening line. So I'm not sure exactly how the county is going to attack this, but they can look at things like that. What's I'm pretty sure not going to happen is that the screening will be done at the departure airport. And part of it is, like for example, Honolulu, they don't have any travel quarantine requirement. And most of the travelers coming from Honolulu are, why am I going to spend money and put people to screen because the other county, has this requirement? And that's why, we're not going to get at the departure airport screening.
So let me ask you, we've had this problem before, but I guess, you've kind of looked into it, but if each county that other than Oahu will have their own procedure, I know Representative Saiki wanted that bill to kind of make it uniform, right? To get rid of confusion. I guess we're going to have confusion just by the nature of it, because what the Big Island's been doing so far is different from what Kauai has been doing. So I guess my question is there a collective training going on right now that when the program kicks in, every county should know the basics, what to ask for? Is it being done right now?
We're coordinating with the counties right now, but again, they're going to run their own program. They know what the minimum requirements are, right? Every traveler has to register in Safe Travels, fill out the appropriate fields, do the attestation that, everything that I put in here is accurate and the card that I uploaded is not falsified. Do that attestation, and then be screened at the arrival airport. That's kind of the basic general guidelines. We're not dictating, hey, you're going to have a minimum of 5 screeners for every 10 people, and all that kind of rules. That's going to be on them to figure out.
Okay. Now, what about say, we are getting reported cases now of fully vaccinated individuals still getting sick, right? I'm almost positive because if you put that on any informational forum, it will kind of create a red flag, right? In a sense. And what you're trying to do is you're trying to expedite your way in just getting to your destination without having to quarantine. if that person did in fact get sick, like say the person got sick on the Big Island and needed some type of medical intervention, then probably that report will be with the DOH. That the person, okay, would that information basically follow this person if that person is coming to Kauai now? If that person didn't put it on their Safe Travel app, the information that they were sick within the last
Right.
week.
Yeah, I don't know the answer to that. I would venture to say no. But again, they got to fill out, that's one of the health survey questions, right?
Right.
They got to answer that. So if they answer it truthfully, then they know they wouldn't be able to travel.
Right.
Yeah.
Well,
I oh, go ahead, Charlie.
no, I was just gonna say, I think, many of us want to move forward, but and I think one thing comes to mind is in the inception of the program, the Safe Travels program, I think many of the local people would embrace it, but because of the lack of enforcement, it left a really bad taste in everybody's mouth. And so that's why I think, you, the lieutenant governor, even the governor, just by some comments may have gotten it hit hard because they're saying, wait a minute now. It always seems like we the locals, we abiding, but you got a whole bunch of travelers coming in, nobody's wearing masks, and yet nothing's happening. Or something did happen, but all of those citations and our arrests all got vacated. That they say, okay, let's start from zero again. Who's going to be responsible on the enforcement side of this program? Is it up to the counties? The counties themselves?
Yeah. So it's primarily the counties. The Attorney General does have, a bunch of investigators, and they've been doing the lion's share of enforcement and getting things prosecuted. What on the positive side, though, the Honolulu Police Department have been getting really engaged, especially in these mass gatherings. We receive complaints. I got an email, I think Angela Heen and the Kapu Breakers, and she brought some alarming information to me that I wasn't tracking. And we started working with law enforcement, and man, the very next weekend, HPD started arresting people. I think you guys saw that on the news. Another positive thing is the legislature just passed that bill where you reduce, you had the 5 years and then, the misdemeanor, I think it was. Now it's just a citation. So it's easier. So it doesn't have to bog down the court system. So that's going to be, helping us to do enforcement, because now the law enforcement is not going to be hesitant, right, to actually arrest people or issue the other citations. So that's another really positive step, I think, for the state. Earlier, you had talked about the fully vaccinated people getting infected. So we got to look at it holistically, right? Real big. Yes, people are getting infected. Last week, I think the report was 38 in the state. Now, put that against the 1.4 million in the state of Hawaii. And then all of the symptoms are very mild. So, that's why we try to encourage people to get vaccinated. Not the vaccines, they talk about efficacy, right? How efficient is the vaccine? Pfizer was 95% when they did the test. Moderna was just a little bit behind that, but that was pre all these variants, right? All the hybrid cases. So yeah, the infection is spreading to people that are fully vaccinated, but really, really mild symptoms, like a mild cold. And then more importantly, it is not if the vaccines wasn't working, a whole lot more people that are fully vaccinated would be infected.
So one last question. So, and I guess this is something for the DOH. We've been kind of really gnawing at this because you talk about the variants, and then yet if we were to compare stateside that have those major spikes, right? That's happening right now, and it seems like a lot of them are variant related. why is theirs? I mean, and they've got vaccination programs. I mean, larger than Hawaii, just by based on population size. But why are they why are they getting hit really hard and we're not? Is there something that maybe you folks have seen because we're situated in the middle of the ocean, or what is it? Because every time
Yeah,
they
so
say
that's
be prepared, every time they say be prepared for surge, everybody bracing, but it just doesn't seem to hit us, and it's a mystery. It's a mystery to many of us.
I think if you look at everything we're doing in the state of Hawaii, and you hit on it one, right? We're in the middle of the Pacific Ocean. So in a way, we can control our borders where other states cannot. And in some of the states where you see the huge surges, they don't have the same orders and rules. Like we're in a tiered system. Some of them, their restaurants are wide open. They don't limit how much people. Some of them don't have mask mandates, right? Hey, it's my right. I don't need to wear a mask. Yeah, but now you're getting sick and you're making my family sick.
Right.
But you got that going on, and people are in Hawaii. I talked about the sacrifices. The vast majority, you get the dumbasses not wear. Oh, sorry, I can swear a lot. Sorry. But you get those people that don't wear their mask and don't respect. Remember the malama I talked about? You malama me, I malama you. Mr. DeFries from HTA taught me that. And that mentality is what's saving us. That's what's different. It's our culture. And it's us respecting each other. That's what's making a difference.
Right. Okay.
This is uncensored, unedited. The only thing is, I hope Hawaii News Now doesn't use that in their news thing.
I always get in trouble. Always
see the email in the morning. Mel, can we have permission to use last night's video? I'm gonna have to tell them no. Cannot.
Yeah, please. With the general everybody dumbasses. No, please don't do that. Please. I'm sorry.
I see a lot of comments about HIPAA. People, listen. If you want to travel and want to participate in an exception, then you are going to upload your your vaccine card into the system. That's it. The information is not going to be shared with anyone, and it's you're giving up that right to that card, the privacy of that card. So if you're not traveling and you're not participating, your information ain't going to go anywhere. So listen, HIPAA doesn't apply in this case because your information is protected. Unless once you upload it for the sake of being exempted, yes, Hawaii may have access to your vaccination card copy to validate. That's it. Okay, so if you don't give up that card and nobody know, then take your pre-test and 3 days before and get on a plane. All right, that's kind of. I know HIPAA was a big thing, but it doesn't apply when you are. It's like if I'm in the military. Everywhere you go, you got to carry your medical records, right? You got to carry them, and if you don't want to participate, then you don't want to share it, then you don't share it. But information sharing between state and county, again, if you are not participating in the program, your information is not going to be shared with anybody. So you need to pull the trigger by uploading that into the system. There it is. The other question was, when is the website going to be active? May 7th, according to the general. May 7th is when you'll be able to go up and put yours in the system.
One quick question, General. I've been comparing my CDC card with my wife's card, and I've been noticing, but I guess because of smartphones are really good, you take really good detailed pictures. But I noticed that many cards that have the stamp, it was given a stamp that they put in a block, the dosage by Pfizer, Moderna, and the lot number. Those kind of stuff are slowly disappearing. So I guess people need to go back and ask for another one, right? And then there's cards that I see information that's handwritten. Like my wife's first shot was handwritten. And whoever wrote in that information, I don't know if they were a doctor because I cannot understand the damn lot number. So would these be causes for be problematic, or would they look at just the name and say, okay, they're in the system, vans. They're in the system. Their names were uploaded. They got the vaccination at one of the clinics or the hospitals. But we just kind of make out the lot number. Do you think that would be a problem, or it wouldn't be a problem?
I think that would be a problem, because when you filling out your, that Safe Travels digital platform, in the field, you got to put in the type of vaccine and the lot number. So if you cannot read it, you cannot put it in there. Because the AI, if the human cannot read it, the artificial intelligence will not be able to read it. And that's why we put in the field where you actually got to type it in, because we believe a lot of the handwritten stuff will not be able to be read by that computer system. So remember that chart I put up with the phone numbers? Go ahead, get that thing fixed. Maybe they can, when you talk to them and you tell them what the problem is, you don't need a new card. They just give you that number and you just write it in yourself and fix it. That would be my recommendation. But you definitely need the info. Even my wife's card, they did them backwards. They made her last name, the first name. So luckily, when she went to get her second shot, Hawaii Pacific Health fixed the card.
Yeah, I think people I feel a lot better now with the validation process. I feel for the counties, especially ours, our small county with very limited resources, on how they're going to put staff over there to actually validate.
But Mayor Kawakami, right? He's all in, man. When he goes, he figures out a way.
Oh yeah.
He go all out.
And I got just as a side note here, and I saw Sarah posted it earlier. She said, Kauai, right now, 55% of our population has initiated the vaccine. So Kauai is in really good shape as far as that goes. Someone's asking me about laminating the card. You have any? I know I've seen some people say you shouldn't, because when you put the laminating film on it and it goes through a heat, if it's a sticker type, it's probably not a problem. But I've seen some people say that when you run it through a heated laminator, it could distort the ink. And I don't know if
so for Hawaii, we're going to accept laminated cards. My recommendation would be not to laminate it, because the rest of the world, even international, they may recognize the card but say, hey, if it's laminated, it's no longer valid. A lot of documents like your birth certificate, marriage certificate, if you laminate it, that thing is no longer good. So my recommendation would be not laminated. Just keep it safe, like your passport, and you'll be good to go. Because I don't know what the other states or other countries will.
Yeah, take it. Put it in a safe place, like your Social Security card, and take a picture of it, of your vaccination card, so you have that permanent record in your phone. And
no, a lot of people, they tend to do it. They put it in their safe. The problem is they forget the combination.
Yeah, I know how that goes. One more question, and I know one of the and you just mentioned that the people that are vaccinated, the chances of them getting really sick, going into the hospital and dying, significantly reduced. But do you know if there's any talk about having more testing as we go into this new program to verify that in fact this isn't spreading, because of the asymptomatic nature of vaccinated people? Many of our vaccinated people don't get symptoms; they're very mild symptoms. So has there been any talk about possibly for maybe 2 weeks or a month, upping the testing to make sure that in fact the virus isn't being spread?
To answer your question, yes. So the Department of Health has a overall strategy. What I think you're alluding to is the community testing, and surveillance testing. DOH received some money, and they're going to be distributing that to the different counties. I think these are the numbers that Dr. Char, don't hold me to these numbers, but she talked about 256,000 for the island of Hawaii. I think it was 91,000 for Kauai and 219,000 for Maui. And I believe she said 1.2 million for Oahu. And this is a grant for testing statewide.
Got it. Got it.
Wow.
One last question, and I don't know if you can answer this, but when do you anticipate this this system here in Hawaii to be fully digitized, so there will be no need for humans to be on the receiving end or the arriving end, whereby you know it'll be, you go through TSA, you get the check mark, or you get through the screening table, you have a check mark, but it's all digitized or electronically done prior to arrival. Is that something that's in the near future, or?
I think in the near future, as long as we can tap into that Department of Health database, the answer is yes. And like I said too, right, once you get that check mark, you're good to go from that point forward. You don't have to keep uploading the card and have the thing go and double check. You're already good.
Did the Department of Health ever say, you know, looking at like the pre-check, TSA pre-check, right? You go in, you answer a set of questions, you do all of that, you pay your fee, and basically bingo, you know, you've gone through like a federal vetting system, right? TSA. Did the DOH ever say anything that would seem to suggest that maybe if we wanted to get on the system for the purpose of getting through much easier, if facial recognition would ever be used where, like say, if I wanted to go, I go to the local Department of Health here in Kauai, I go and I take a picture and they upload it, just so that it can be used at every airport saying that Charles, you know, yes, has been vaccinated and he has been cleared. Did they ever talk about anything like that?
Not Department of Health, but my department has been working with several vendors. We've been working with Common Pass and Clear, and then most recently with First Vitals, and then there's a whole slew of other ones that have that type of capability. The first two I mentioned, Common Pass and Clear, we started working on, and they already had pilots for the pre-test. So to be able to verify that, hey, yeah, this person in fact did go from a trusted travel partner, got the NAT test within 72 hours, and then they'll be clear to, you know, all those systems that they get in the airport, that you just go there and then you get cleared through, and the same way like how United at the departure airport, you get cleared and you just walk right out of the airport when you get to Hawaii. We're trying to get the same type of capability for this vaccination, but they're having the same challenges that we have with the continental United States. There's no central database with the information is in. Each state has their own database, and then not every state will be willing to allow us access to be able to tap in there and do the validation. So it's going to be hard, and we're hoping if we do start opening up for Trans-Pacific, we'll do it similar to other things where maybe it'll be, hey, we get the agreement in California first. So if anyone get vaccinated in California, we can verify to your database, you can be cleared. And then maybe it's Oregon, right? And then maybe it's Texas, so or whichever state that we do this coordination with, and that's our hopes. And we'll slowly start trialing in more states. And then again, as we get closer to this herd immunity, right? As people get vaccinated, and then we start seeing those numbers drop, right? What we're watching, the hospitalizations, the infections, and the deaths. If those are all getting to zero, then there's no reason to do this, right? We're going to stop the inter-island travel quarantine initially, and then we're going to kill this entire Safe Travels Hawaii program. There's no reason to even do it. No pre-testing or anything, because everyone is immune or close to immune to the thing. Even if you catch it and it's a mild cold, it's like any other cold. Why are we going to spend millions of dollars to try to prevent the virus from spreading if it's not severe? You kind of runny nose, cough a little bit, 3 days, and then you're done.
Real quick, I just want to answer this question from Lisa. I have a question. My son and myself will be moving back home to Hawaii in August. I know we have to take a COVID test here in Vegas. What do I do when we get back home to Kona? Big Island, I believe, still has that post-arrival testing. I don't know if that's going to continue, but yeah, you got to get that test from a trusted partner 72 hours before your arrival. So make sure you get that test done. in August, I'm not sure what it's going to be like on the Big Island. Right now, yes, you'll subject to post-arrival test at the airport.
Mhm.
The other question, private vaccination locations. So right now we have pharmacies giving vaccines. You have different outlets doing private clinics doing vaccines. Will the counties have access to that data as well? Are those records housed at the Department of Health or anywhere? So let's say someone got a vaccine from CVS and they upload it into the system. When that person arrives on Kauai, will Kauai be able to validate that?
Yeah, because right now, everyone that's vaccinated in Hawaii is required to fill in that VAMS information within 72 hours. Everybody.
So regardless of where you have it.
Correct.
Okay. Got it. Thank you. Thank you. Thank you.
That's good to know. Good
You
to
see,
know.
that's the thing. It's hard because the news, even the press conference, it goes boom and you touch on so many things, not really able to. I love being able to ask you questions from our viewers. My questions are coming from the viewers, and there's a lot of questions that are uh, for different matters, but I kind of want to focus on this program because I think a lot of people are concerned. But I will tell you, General, that I feel a lot more comfortable after seeing your presentation and hearing you. I think the tiered system of going inner island, and then at some point, when we can show that, and these are for the people that came in late. I know someone already asked about what if I lost my card? Go back to where you got the vaccine and ask them to get a duplicate card, wherever it may be. But starting off with inner county, and then I really like the part where you're saying the next level will be trans-Pacific, but only for people that were vaccinated in Hawaii.
Correct.
Prior to going to the full trans-Pacific. So,
Right. And we're not favoring Hawaii residents. It's because that's the only way we can validate that you're in fact vaccinated. And when we can, get that integrity, right, to be able to tap into another state's database and validate that you're vaccinated, then we'll open it up.
right. So I think for a lot of people that are objective, let's just say that for people that are objective, that brings some sense of comfort. Anyway, for me, it does. I just my concern is that we watch what happens in the next couple of weeks, or after a month after we started, and make sure through surveillance testing that in fact more viruses, more cases aren't popping up. So I think this is probably the safest way to do it. So I appreciate the clear explanation, and I hope our viewers can see that. If you have any questions, viewers, you can go ahead and put it in there. But I think the general answered most of your questions anyway. Charlie, I don't know if you have any other questions.
I wanted to find out one last question, and that is, and you're right, the end game is to kind of eliminate everything, as much as possible. Is there cause for it? Well, I should say, is there any caution? Because they talk so much about the fraudulent cards, right? And I'm trying to understand, why will anyone want to make a fraudulent card unless they either hide their identity, one, or they're trying to get to a target location for some unknown reason, and they can't do it any other way. So, I mean, do you anticipate Hawaii having a whole slew of fraudulent cards like some places in other countries as well as the mainland?
If you're talking about the people of Hawaii, I have wholehearted trust in the majority of them. Yeah. I think very, very few bad actors will try to defeat the system. And the risk is high. We don't know if the feds are going to want to charge you too, right? If you fabricate a federal document, that could be a federal offense, even if it is a misdemeanor. I don't think it's worth it. Some will want to do it. The incentive is going to be to save money. And we really feel the risk is higher from CONUS, right? Because if you got to take that PCR test 72 hours, if I have a family of 5, and I'm paying $125 to $150 per person, if I BS all this information, I save choke bucks, right? So the incentive is saving money, And then there's some people that just, hey, they don't want to follow rules, and I don't care. I don't think I need to be doing this, so I'm going to fake it. But I think the vast majority of people of Hawaii are going to do the right thing, and I've seen it from the beginning. You know, we talked about the malama, right? You malama me, I malama you. Most of the locals, you see them, they're wearing their masks, they're watching their distance, they're following the rules, they're not throwing these huge parties. Get some knuckleheads, I used the wrong word earlier, but there are some knuckleheads out there that don't follow it. And you know what? Some of them are not, although they live here, they're not locals, right? We had a problem of other groups here throwing these large organized parties underground.
Right.
And I'm glad HPD started to arrest these guys.
Good.
I think you're going, you know, I think you're going to always have, I mean, there's no way around it, but I agree with you, General. I don't think we'll see too many Hawaii residents going and submitting a false, not for this. I mean, I think the only incentive would be to save money, like you said. And it's just, and in fact, in many cases, you can get that test at a reasonable price now. And I think it's just, the risk is too great. But nonetheless, you're going to have it, or someone that knows they have COVID, or they are positive, and they know if they take the test, they won't be able to travel, so they may, you know, falsify, and they never got vaccinated. They might create a card. We know the cards are available online, and that's why I'm really adamant about that validation process, and that has to be done. And there can be no shortcuts. And we've heard, you know, where people, when the lines get long, we've heard, and I've heard firsthand from people that were in line that saw the screeners just say, hey, you're good, just go. That also is human nature. That will happen. So we can only do the best we can do, and we'll see what happens. And I think starting off intercounty is the best way to do it, and we'll get a chance to see how this program works. The other question,
we'll keep moving forward, right? More and more people get vaccinated. You know, the supplies are coming in. We can scale up if we get more doses, and we think, you know, I'm thinking July-ish, we're going to be close to vaccinating everyone that wants and is willing to be vaccinated.
yeah, and that vaccine hesitancy, I think, is a problem that we got to really. We've done that. You know, we've had the Department of Health on our show to explain the vaccine and try to get people that are on the fence, give them the information that they need to realize what it really is. And I think hopefully it's working. And my last question, I know it's 8 o'clock already. My last question is, and this from the viewers, and I know we told you the last time, your guards guys here on Kauai is just rock stars. You know, they are incredibly. I ran into one yesterday. I was picking up lunch, it was yesterday, and he was off duty, but we were at some hole in a wall place in Hanamalu, and he said, "Hey, excuse me, sir, is the food here good?" "Oh, these are local, brought up tattoos. I mean, you know, good shape." And I said, "Where are you from?" He goes, I'm from Oahu. I'm here. I'm with the guard." I said, "Oh, bro, thank you for your service, man. I appreciate you." Yeah, the food is great. This guy was so much aloha. But all we hear from the people here, they've come to my neighbor's house a couple of times to check quarantine. These guys are so professional. I just want to give them some kudos and some recognition, because they're doing an awesome job. The question is, how long more do we have them? How long more do we have them?
So first off, I appreciate what you're telling me. And, you know, it's always good. We do your job, and even a small little, you know, pats on the back means a whole lot, especially when you tell the soldiers. So, you know, if you're doing a great job, just tell, hey, brother, you guys doing awesome. And it goes a long way. My son was there. You know, I commissioned him in May, became a second lieutenant. Very next day, he was on the island of Kauai. And he just got back last week because he got to go to school in a few weeks. But for right now, we have authority to the end of September. But there's difference, right? So there's authority to get them, keep them on, we call Title 32, 502F federal funding, but controlled by the state. But what we don't know is the funding. We get funding in 2-month increments. So we believe we will be able to keep them on through September, but that could change, especially as if the country gets closer to herd immunity and we really don't need them, then, obviously the president's going to make the decision to stop funding National Guard.
Yeah, well, amazing. They're doing a hell of a job. I think everybody appreciates. Sometimes it's going to be tough to see them go. It will be, and I hope that doesn't happen. So, anyway, General, it's 8:02. Any closing comments for our viewers? We got a ton of them on tonight.
No, I get it. Thank you two first for the opportunity, but more importantly, thank all of you, the people of Hawaii. You malama me, I malama you. We're gonna get through this together. So thanks for everything. It's been a tough year for me, but getting a little bit easier now. And we can see the light at the end of the tunnel. And if you're on the fence, if you're not sure, I can assure you the vaccine is safe. You look at how many millions and millions of people have been vaccinated without ill effect. We talked about the effectiveness and importance of getting to herd immunity so we can get out of this thing and move forward and get this economy rolling again.
Thank you, sir. Charlie?
Yeah, I mean, you're not thinking about, General, you're not thinking about running for office next year, right? You're not thinking anything like that, right?
And then after he fainted and he got back up, then I told Nabra, I'm just kidding. No, I cannot. I'm a soldier, man. I cannot handle politics. My mouth gets me in trouble. My temper gets me in trouble. I tell it like it is. I don't lie. I don't sugarcoat anything. So I won't be successful as a politician. Not that they lie. It's not me.
I do want to say thank you again. It's always a pleasure having you on. And you're right. You tell it straight like it is. You don't sugarcoat it. You don't dodge any of the fastballs that we throw at you. But I know the viewers appreciate it. And to our viewers out there, thank you so much for keeping it simple, keeping it straight, helping us all understand this. This is, while there's definite light at the end of the tunnel, it's still, amongst many of us, it's still confusing. And we just, when we have somebody in authority that can, straighten things out, it gets a little easier. I'm not going to say it's 100%, but it sure is better than it was last week, for sure. And thank you very much, General, for that. Thank you.
All right. Thanks again. Mahalo, guys. Take care.
General, it's always a pleasure. General, before you run out, I just want to clarify that I know if you were here earlier and you heard the General, this is what he said. I know some of you heard wrong, but I hear it was dumb aces.
Right. That's what I said.
That's exactly what I heard. So anyway, General, thank you so much. I don't know, for some reason when it comes from you, it's I don't know what it is. It's just much more believable, much more impacting. I think our viewers, myself and Charlie for sure, appreciate you and just the way
the General doesn't like the letter S. So here, that's what he said. Some S's.
Yeah.
That's what I thought. It was a apostrophe S.
Yeah.
But
Awesome.
And we always the invitation is always open, General. If you want to use this platform to share updates or whatever, we appreciate you. To our viewers, guys, listen, we are moving this way. Charlie and I have been very critical in many cases. We're not stopping the train. Let us all be part of the same ohana. Wear your mask, wash your hands, social distance, avoid the large gatherings, guys. We will get through this together. But if we get the dumb aces out there that continue to go test, gonna take us longer. So guys, do the right thing. We appreciate you. Almost called you governor. Sorry, General. That's not good.
You can give me trouble again.
I know, because he watches this afterwards. He's gonna watch this tonight when we go offline. So, General, mahalo very much. Viewers, we love you guys. We'll be back on Wednesday night. No, this is Wednesday. We'll be back on Friday night. You guys all take care. We'll see you then. General, stay safe. Keep up the good work, man.
We do.
Yeah.
Follow up.